Okay. Hello, I'm here to do the nail care video. I'm going to come in, do hand hygiene before I come in, knock on the door before I enter. Assume that this is up and that the patient's bed is made. It's nothing funny like it being down. Okay, so I introduce the patient, myself to the patient. I explain the procedure to them that I'm going to be doing their fingers and their toenails care. I make certain that I have an order from the physician if I need one. If they're diabetic, then they may need a physician's order, or if they have some other reason, they may need the physician's order. So I'm going to double check on that. After I've explained to them the procedure, I'm going to assess their knowledge of nail care, make sure that they know how to do it properly, watch them do it if they say they do know how to, make sure that they're cutting across in such a way that they're not going to get an ingrown toenail, make sure that they understand their risks if they do get a puncture or get a laceration from nail care, if they have chronic conditions such as diabetes. I'm going to make sure I know about any conditions they have, like diabetes or anything else that would diminish their peripheral vascular functioning. If they have neuropathy, they have less sensation down there, I'll make sure I know that. I'll ask them if they have any concerns, what their normal foot care is, or what their normal hand care is, if they get corns, what they normally use on those corns, things like that. Get a good history of what they normally use and what they don't, or and make sure that they know how to do their own care. Other than that, I'll go ahead and I'll expose my patient to be able to do this. Well, before I expose my patient, I'm going to gather my supplies. I'm going to have some warm water. I will test the water myself, and I will have the patient test the water to make sure it's not too hot or not too cold, for that matter. Then after I do that, I'll go ahead and expose the patient and expose the patient down to their feet. I will then cover the patient using a drape or a bath blanket. I've got the drape on now. Got that bath blanket on now to keep them warm and to protect their modesty a bit. Now I will inspect their pulses. Check their radial pulse there. Check their dorsal pedal pulse here. Make sure they're getting good perfusion to their extremities. I'll check their hands for inflammation, any cracking, any redness, anything like that. I'll do the same thing with their toes. I'll check if they're getting any cracking, if they're getting any inflammation, if they have any fungal infections going on, what their nails look like, the shape and color of their nails, make sure those are good. I'll ask them if they use a lot of nail polish remover, and I'll document any of that. I already made certain that this patient does have an order, that they don't have a contraindication for nail care, and if they do, that there's a physician order for us to do it. I will place a towel underneath the patient's feet before placing the base in there, and I will soak the patient's feet. Normally their legs would bend. If they didn't, then I'd probably do something different than that. But I would place the feet in the wash basin. I would soak the hands in the kidney emesis bin, and after I've got these things soaking, that's when I really ask them all those questions about their care. If they were able to, or if they said they know how to do their own care, I'll have them show me so that I can see if they know how to avoid getting ingrown toenails, anything like that. But other than that, I'll just I'll watch and make sure that they're they have coordination to do it, and that they're not going to injure themselves doing it, and make sure they understand the risks of self-nail care if they have a condition like diabetes. And now that I've had their hands soaking and their feet soaking for a while, I will get the nail brush, and I will, while still submerged in the water, I will brush the nails and clean them, clean the nails, and I will get this pick here, and I will clean under the nails, get any debris out, any dirt, anything like that. Make sure they don't have any debris or dirt under their nails. Some people scratch themselves, they put their fingers in gross places, and you want to get that scraped out of there so it's not in there. And after you've cleaned their nails, you can then, if they have diabetes or another condition like that, you just file their nails down. You file them flat so they're not curved at the end, just so that there's no chance of an ingrown nail. And you clip them. Normally you clip them, and then you file any sharp edges that come off. You file them down to make sure that they're not going to have them catch on anything. But you just file them if they can't have them clipped for a reason like having diabetes. Also, when I check the pulses, I did check the color and the temperature. I checked the cap refill, make sure it's normal, their temperature, their hands aren't too cold or are retaining the temperature like they should be. Same thing with the feet. After I am done cleaning them and after I'm done clipping them, I would dry, well, I think I'd dry them before I clip them. Make sure that they're good and dry. Make sure I dry between the fingers. Make sure to dry them everywhere that I can so that there's no risk of, so it alleviates risk of infection. Same thing with the toes. With the toes I would scrub the calluses of the feet with a washcloth. So get a washcloth here, scrub the calluses of the feet. All the calloused areas of the feet, scrub those. Check for anything like corns. Check the calluses, check for cracking, check for infections, anything like that. Any dryness. Then after I do that, then I would clean the toes the same way with clean the toes with the brush, and clean the toenails and the toes with the brush. Clean under the nails, making sure to scrape out any debris from under the nails. And then I would dry the feet. Make sure to dry between each surface. I would go ahead and dry between each toe. Make sure to get all the surfaces completely dry. And then I would clip the nails or file them down. I would file them flat so there's no chance of ingrown toenail. If they know how to do their own nail care, I just make sure that's what they were doing. Other than that, after I dried them, after I cleaned them, I could apply some lotion. I could apply some nail polish. If they're a female patient, when I was cleaning the cuticles, I didn't push the cuticles up, but I scrubbed the cuticle area. Oh, and other than that, his hand still isn't in this basin. I removed it after I washed it. Then after you're finished, you can go ahead and dispose of your laundry items in the laundry hamper, and you can remove this. If you were going to do a bed change, you could leave it on and do the bed change now. Or you're doing a bed bath, and this might be part of your bed bath. While you're doing that, you can start the feet and hands soaking during the bed bath. Make sure the patient's covered up and warm. Ask the patient if they have any needs or any concerns before you leave them. And ask them how it feels, if they're you know, if they feel better, if they need anything else. And then other than that, I want to dispose of all the disposable equipment and put away all of your equipment. Finish with some hand hygiene. Make certain to document any findings, to document the procedure, and let's document the findings, document the procedure that you did. Oh, I thought there's a third thing, but I can't remember it. So, yeah, you document, make sure you document everything. And if this wasn't up, then you would make sure it was raised up. Make sure that the patient's within reach of the call button. And then once you're finished, lower the patient down to the lowest level. So, okay.